Okay, continuing in the middle of F for benzodiazepine withdrawal symptoms. After fear. Um, Appears abnormally looking, feeling bloated, feeling like the ground is moving beneath you as if you're on a cruise ship or boat, feeling of extreme cold, feeling of impending doom, feeling of vulnerability, feelings of shaking inside and out, feelings of shame despite realizing this was all an accident, not your fault, and that's feelings of shame regarding getting into the situation in the first place, taking benzodiazepines, so away feeling weak. Feelings of the spirit being out of synchronicity with the body, which is a scary one. Feeling of unreality, which kind of goes with derealization. Uh, Feeling of worms under the scalp, that's another scary one, similar to the brain moving inside the head. Female ejaculation or incontinence during an orgasm, which is no fun. Fingernail problems, median nail dystophy, which means basically getting light colors in your nails, or having lines and ridges around the center. Having flashbacks from other experiences, whether they be traumatic, psychedelic experiences, other drug experiences, whatever it may be. Fluctuations in blood pressure, flu-like symptoms, flushing, blood going into the face, stuff like that. Formication, sensation of bugs crawling on skin, I'm sorry, but it can also be under your skin. Fuzzy feeling in head, gait disturbances, hard to walk straight, gastritis, glassy eyes, goosebumps, very visible to the eye, grinding teeth, also known as bruxia, hemorrhoids, which nobody wants, hair loss, thinning and dullness, hallucinations, auditory and visual, headache, mild or severe, heart palpitations, pounding or racing heart, heartburn, heavy arms, legs, and head. I'm experiencing that right now. Heavy pounding of the heart, holding onto the walls in the shower. I don't know why that's funny to me. Hostility, hot flashes, hurts to wear clothes, or a car seat belt, which goes under hypersensitivity, unable to watch the news, see films, read the newspaper. I guess hypersensitivity has to do more with the eyes, but hurts to wear clothes. I feel like hypersensitivity should also deal with all of your other senses. Hyperactivity, hyperacusis, profound hearing sensitivity. Oh, okay, excuse me. Hurts to talking, phonies, etc. Hypersomnia, sensitive sense of smell. So let's just skip all these different jargon words. Basically, your senses will be more intense, all of them. Then there's sensitivity to light down here, sensitivity to stress, um, over breathing, having hypnologic. Never heard of this. They mean hypnagogic hallucinations and sleepwalking. I don't know why they would put hypnologic. Hysterical and inappropriate laughter, IBS, irritable bowel syndrome, impacted bowels, impairment of motor coordination, impotence, which can be permanent. All of these can be permanent in all reality. That's something I tried to stress in the other video, that while you're going through withdrawal, anything that you experience may last. So that was a big point to people who have not gotten on these medications, to do your best to never get on them. Impacted bowels, impairment of motor coordination, impotence, inability to comprehend the simplest things. Again, these things can last, people. Inability to concentrate, inability to cope with a lot of information, inability to draw a satisfying breath. I've been having that a lot. But you just have to try, people. You just have to try. Inability to draw, I just read that. Inability to make a decision, inability to read or write. An inability to make a decision can lead on to much more difficult things, such as OCD. That's the main one that comes to mind, and you don't want to be stuck with OCD. I'll make a different video on that, how to combat OCD and how to live your life free of needing to make, either small ritualistic changes or having to organize small things to the point that it drives you insane, how to stop that. So, excuse my cough. Inability, come on. Incontinence, frequent or urgent need to urinate, unable to hold or pass urine. Again, these things can be permanent. Increased saliva, I've been having that. Indigestion, I've definitely been having that. Insomnia, not so much, luckily. Take melatonin. A lot of people will tell you that that's not necessarily good for you. Try to stay on small doses. Intense fuzzy feeling in the head, intense jaw pain, I've been experiencing that. Intrusive thoughts, more or less, but they can be, I'm talking about myself, but for other people they can be extremely perverted, dangerous, mean thoughts. Jaundice, which is basically your liver shutting down. Irritability, irrational rage, jaw, tooth, neck, and shoulder aches and pains. Jaws clamped together. Excuse me. Jerks in arms, legs, fingers, joint aches and pains. Joylessness, which is basically dysphoria, but I guess surrounds more joy. Jumpiness, jumping toe, lack of concentration, lack of coordination, left/right-sided symptoms. So I don't know exactly what they mean by that, but for me, I've been mixing up my left and right a lot. I think what they mean is that half of your body will feel a symptom and the other half won't, which both are equally strange. Legs, arms, and head very heavy, so the whole body feeling heavier than it needs to be. Whitening of the nails. Libidinal. What is that word? Libido. Libidinal changes, variations in sex drive, very common. Loss of balance, loss of coordination, loss of confidence, loss of control of movement entirely. Loss of interest in people and or things, loss of memory, loss of self-respect, loss of taste or metallic taste, or just tasting stuff in a totally different way than you used to. Loss or changes in appetite, that can be either eating a lot more or eating a lot less. Lung pain, which is scary. Memory problems, short-term, menstrual problems, painful periods, irregular periods, or cessation of periods, meaning you can stop having your period, which is as dangerous as if you were to stop eating for a long time in your younger years, if you've been through anorexia or something similar to it, bulimia, not more with anorexia, that you can stop your menstrual cycles completely, which is very dangerous if you ever want to have children. Mild hypertension, mood swings, morbid thoughts, mouth and tongue soreness, muscle spasms, muscle tone, muscle wastage, which is, you can't exercise and gain anything, even if you have the proper proteins, even if you're doing everything you could possibly do to benefit yourself in a health conscious way, you won't be able to get any muscle tone. Muscle weakness, muscles lacking, locking and being rigidity. Muscular aches, pains, cramps, and spasms, muscular rigidity, they repeated that one. Nausea, flu-like symptoms, nervous tics or twitches, nervousness, I don't know what that one is. Neurological problems, that's basically what the one above that was. Topical nerve anesthesia, so not feeling things on like the base level on your skin, being numb or tingly, I don't know how to explain it. Night apnea, night sweats, nightmares, I think they mean sleep apnea. Nosebleeds, numbness around the face, the mouth, or any other part of the body. I already said that. Numbness, pain, obsessions, obsessive behavior, oedema, especially on the face or ankles. I don't know what oedema is, but through this whole slew of symptoms, I think you can forgive me if I don't know what a couple of them are. And we're at O from F right now, so we're going to try to finish this one off in the next video. Thanks for watching. I hope anybody who isn't taking benzodiazepines now doesn't plan on taking them in the future is getting something out of these videos. Or if you are taking them, not be scared from all these symptoms, because the grand majority of you are only going to experience a handful of them. But plenty of people do experience all of them, or a good majority of them, so that's why I'm listing all these off. Thank you.